Endoscopic ultrasound. Areas examined and treated: esophagus, stomach, duodenum, pancreas, bile ducts, gallbladder, lymph nodes, rectum if lower EUS is performed. The procedure. Diagnostic. This is an internal ultrasound examination using an endoscope. The endoscope has a small ultrasound device at the tip. It allows detailed imaging of the digestive tract and nearby organs. Biopsies may be taken using fine needle aspiration or fine needle biopsy. Therapeutic. Various therapeutic maneuvers can be performed when needed. Fluid collections may be drained in selected cases. Treatment planning may be based on EUS findings. Before your procedure, schedule your procedure. Appointment. Schedule your endoscopic ultrasound appointment with GastroDoxs by phone at 832-632-4070 or in the office. Location. A procedure location will be suggested based on your insurance and geographic area. Please refer to the locations page on our website. Insurance. Our team will obtain the required insurance prior authorization if needed. Financial. GastroDoxs provider fees will be collected upon scheduling your procedure. Orders. Our team will send your procedure orders to the hospital or surgery center. Transportation. Do not plan to drive after your procedure. You must have someone 18 years old or above to drive you home. No Uber, Lyft cab. Changes. To cancel or reschedule, call or text GastroDoxs at 832-632-4070. Register with the surgery center. General. A representative from the hospital or surgery center will call you to discuss the registration process, time, and location of your procedure. Clinical. The pre-assessment testing team will discuss the following: medications, clearance if necessary, medical history, blood thinner, use diabetes, history, pre-anesthesia questionnaire, surgical history. Financial. Hospital, anesthesia, and pathology fees are independent from GastroDoxs. The other fees not related to GastroDoxs are to be discussed directly with the other providers, hospital or surgery center. If you have not heard from the financial representative 24 hours before your procedure, call them at that time. Clearance. Cardiac hematology, neurology, pulmonary. You may need a clearance if you have high-risk conditions requiring clearance. You may need a follow-up with your doctor or provider before they can issue a clearance. Our team will send your doctor or provider a clearance request from our office. Once our team has your clearance on file, we will call you to schedule your procedure. You may need a clearance if you are on blood thinners or these medications: apixaban, Eliquis, clopidogrel, Plavix, dabigatran, Pradaxa, edoxaban, Savesa, prasugrel, Effiant, rivaroxaban, Xarelto, ticagrelor, Brilinta, warfarin, Coumadin, and Jantoven. Medications. 1 week before, blood thinners may need special instructions. Hold blood thinners only if instructed by your provider. Hold iron tablets. If instructed, hold multivitamins if instructed. Hold GLP-1 agonist. Medication: dulaglutide, Trulicity. Exenatide, Bieta. Exenatide, extended release, by durian bisiais. Liraglutide, Victoza. Lixisenatide, Adlixin. Semaglutide, Ozempic, Wegovy, Rybelsus. Tirzepatide, Mounjaro. One day before, hold oral diabetes, medication if instructed. Insulin, take 1/2 the dose. If instructed by the pre-assessment team, procedure day. Blood pressure, medication, as instructed by the pre-assessment team. Insulin, hold unless instructed otherwise. Others hold unless instructed otherwise. Other, continue to take your medications unless specified below. Blood thinners will require a clearance on file before scheduling when needed. The pre-assessment team, PAT, will review your medications and may make other recommendations also. Diet instructions. 2 weeks before. Foods, no change unless instructed by your provider. Liquids, drink plenty of water. 1 week before. Foods, no change for most upper EUS procedures. If lower EUS is planned, bowel preparation may be required. Follow the facility instructions carefully. Liquids, drink plenty of water. 1 day before. Foods, for upper EUS, stop all food after 12 a.m., midnight unless instructed otherwise. For lower EUS, follow bowel preparation instructions if provided. Clear liquid diet may be required for lower EUS. Liquids, drink plenty of water until the allowed cutoff time. No alcohol. Stop all liquids after 12 a.m., midnight unless instructed otherwise. Procedure day. No food or liquids on the procedure day unless instructed otherwise. Blood pressure medication, as instructed by the pre-assessment team. Insulin, hold unless instructed otherwise. Others, hold unless instructed otherwise. Bowel preparation instructions. Bowel preparation instructions. Upper EUS. Bowel preparation is usually not required. Lower EUS. Bowel preparation may be required. The facility will provide specific bowel prep instructions. Follow all timing instructions exactly. Clear liquids may be required the day before. Do not eat solid food once bowel prep has started. Procedure day. Diet. No food or liquids on the procedure day unless instructed otherwise. Arrival. Please ensure you arrive 1 to 1.5 hours before your procedure. You will check in at registration when you arrive. Pre-procedure. The clinical team will go through the clinical assessment as well as risks and benefits of the procedure. The anesthesia team will explain all aspects before the procedure. Consent forms for the procedure will need to be signed. Sedation. An intravenous line will be inserted into your arm to administer medication. You will be given intravenous sedation medication during the procedure. Position. For upper EUS, you will usually lie on your left side. For lower EUS, you will be positioned as instructed by the clinical team. Visualization. The endoscope is gently passed into the digestive tract. Ultrasound images are created from inside the body. The provider examines the digestive wall and nearby organs. Images help evaluate deeper layers and nearby structures. Post-procedure. It will take approximately 30 minutes to 1 hour to recover from the anesthesia. The clinical team will observe for throat pain, abdominal pain, vomiting, dizziness, blood pressure issues, heart rate issue, fever, or breathing issues. If you are doing well and have woken up from anesthesia, you will likely be discharged to go home 1 hour after the procedure. Diagnostic. If diagnostic tissue samples or fluid samples are required, they may be obtained through the endoscope during the procedure. Fine needle aspiration or fine needle biopsy may be performed when needed. Therapeutic. If intervention is required, it may be done during the procedure. Fluid drainage or other advanced EUS-guided treatment may be performed only when appropriate. Pathologist biopsies are tissue samples that are reviewed by a pathologist under the microscope. The pathologist will determine the nature of the tissue samples. Follow-up. Our providers will review the report in detail. The findings will be reviewed with you in detail upon follow-up. After your procedure. Recovery. You will be under observation for 30 minutes to monitor for any symptoms. You will be awake within 30 minutes, but may still be groggy for 12 to 24 hours. Do not plan to drive the remainder of the day after your procedure. Transportation. Do not plan to drive after your procedure. You must have someone 18 years old or above to drive you home. No Uber Lyft cab. Symptoms. Normal post-procedure symptoms. Mild bloating or gas. Mild sore throat after upper EUS. Mild abdominal discomfort, grogginess from sedation. Slight bowel habit change after lower EUS. Abnormal post-procedure symptoms. Fever greater than 100, severe abdominal pain or chest pain. Trouble breathing or swallowing, persistent vomiting or vomiting blood. Black tarry stool or heavy rectal, bleeding. Any other severe or unusual symptoms, please call 911 and go to the nearest emergency room. Appointment. Ensure that you have a follow-up 2 to 3 weeks after the procedure. Results. Treatment recommendations will be given. Your results will be discussed in detail. Questions. Call or text GastroDoxs at 832-632-4070. Thanks for watching.